All right, so let's go over the objectives. Number one, identify the basic structures and function of the gastrointestinal system. So it starts with food starts in the mouth, we digest it, and it goes into our esophagus with the help of peristalsis. It goes down into the stomach. It reaches the small intestine, and it goes into, which is divided into three parts: the duodenum, and then your jejunum, and your iliac. After that, it goes into your large intestine, which is larger in the circumference, so it's going to be larger, but it's going to be shorter of compared to your small intestine. The large intestine is composed of three parts as well: the ascending, transverse, and descending. The second objective is discuss factors that affect bowel elimination. So these are going to be factors such as age. The older you get, it's going to have an impact on your bowel elimination. It's going to be diet. It's going to be food intake, how much fiber you're taking, how much, what medications you're taking, because medication can cause constipation. It's also another factor is gonna be infections, like if you have C. diff. Body position, the way you're positioned when having a bowel movement can affect. And for example, if you're in a bedpan, it's gonna affect whether if like you're in a toilet, you're on a 90-degree angle, you're gonna have more of an angle, and that's gonna help a lot more. And if you have pain too, surgical pain or pain from different sort of pains. Number 3, describe normal bowel elimination. So everybody's gonna have their own what they consider to be normal. Some people are gonna have 3 bowel movements a day, and that'll be normal for them. Some other people are gonna have 1 bowel movement a day, and that's gonna be normal for them. So as long as you're having normal bowel movements and you're not constipated, it's been like an example of constipation would be like 4 days and you haven't had a bowel movement. So that's something to be worried about. So that would be frequency and inconsistency. Obviously you don't want any like blood in your bowel movement, or you don't want it to be too loose or too hard. Number 4, colostomy. Define colostomy, define ileostomy. So the difference between these two, is that it's gonna depend on the location where it's at. So if it is in your colostomy, it's gonna be in your colon. So, and then that can be in different parts of the colon. And then your ileostomy is gonna be in your ileum, and that's gonna be in the lower part of your ileum. And if we move on into number 6, we're going to look at the various types of bowel diversions. And in your for your colostomy, your colon, the food is going to be it's going to have more of a form. It's going to be formed. And then in your ileum, it's going to be the last part of the intestine. So it's going to be, the food is going to be more liquid, because by then the food has already been absorbed and it's more of a liquid state. So that could cover that. The bowel movements can be in hard or liquid, and when I say liquid, I also mean by diarrhea. Number 7, discuss common bowel elimination patterns. So when you have constipation, some problems that you can develop from there is you can cause cardiac arrhythmias, and that's basically whenever the patient is constipated and you're forcing your body to have a bowel movement when for different reasons it's not naturally coming out. And that's one of the things that can happen if you have constipation. Another thing is that you can put intracranial pressure, and so those are the 2 things for constipation. For diarrhea, if you have diarrhea, you can have dehydration due to the loss of fluid, and you can also have a different type, could be like possible incontinence, which comes with age. Number 8, identify appropriate nursing history questions to assess bowel elimination patterns. So some questions you can ask the patient is, have you passed gas? When was your last bowel movement? Have you had any discomfort or pain whenever you having the bowel movement? What's an example of your diet? And if not, and if there's an issue with that, you can always address that and guide them towards more of a fiber diet, higher intake of fiber. You can also ask if there's like, if they have any abdominal tenderness or pain. For 9, explain a focus abdominal exam, including patient bowel history or bowel elimination. So for that, you can always ask the patient whether if they're lactose intolerant, for example, because that could also play a big role, whether the person is constipated or not, if they're having, if they're having bowel issues, because some people might be lactose intolerant and they might not know it, Another way is that you can always, go back and rely on your assessment, which would consist of auscultating for bowel sounds, if they're active or not, and then, you would auscultate for like 1 to 3 minutes. You could also percuss, and you can palpitate for tenderness in the abdomen, and as a last step, you have to make sure you document your findings and what you found in the patient. Objective 10, describe nursing interventions that promote bowel elimination. So a normal way that could promote bowel elimination, I want to start is just being active. While being active, you activate your system, and in that that just helps with promoting the elimination of a more natural way. Some other ways can also be positioning. Like I said earlier, the way you're positioned when you're having the bowel movement can have a big impact on that. While using medicines, you can use suppositories, and you always have to make sure you educate your patients. If they're having constipation and if they're taking opioids, if they're taking medicines, you have to make sure you address the importance of having a higher intake of diet, like I said earlier. 11, nursing care associated with the use of bowel diversions. So the stomas, all the patients have stomas for different reasons. Some can be like temporary, or some can be permanent. Sometimes their systems are not working, but sometimes they've had a drastic. They've been in a drastic situation that's lead them for their bowel elimination to not work, and so they have to go into, having a stoma and then having this procedure, using the back to as a waste, And it is important to take care of ostomies and keep them clean, as just a normal person, you want to keep their skin integrity well and avoid discomfort or possible wounds, which is severe cases. Demonstrate assessment of colostomy, alostomy, including how to change an ostomy appliance and identify normal finding. So for this, we enter the room, and then we can always ask the patient for the interview, how long have you had your ostomy? How do you feel? You have to make sure you assess the patient and how he feels about it, because at first it could affect the body image. So like sometimes having to be, if it's the first time you have one of these, having one of these attached to your body can distort self-image. So that's a very important thing to assess when you're asking interview with the patient the first time. And then you can ask if he has any discomfort and any sort of anything. You just want to assess the patient as well as your stoma. And then one of the things you look for the stoma is around the stoma is make sure it's clean and dry, make sure it's not bloody or anything abnormal, make sure the stoma is nice and red. And after we've done all that, we get into the fun part. We would put on gloves, do hygiene, everything, and then we would grab one of these, and then we would look at the stoma. We would make sure we use skin prep, make sure we clean around the stoma, nice and neat. Let that make sure it's dry. After that, and the skin prep, what it does is it has a multi-purpose. It prepares the skin, and it also helps for your colostomy bag to stick to the body. So it's important to do that. So you have your stoma, you've measured one of these, and let's say his stoma came out to be, it has a circumference of like 1.5 inches. After that, you would cut this with the scissors, and I already did mine in advance, and this is what the remainders looks like. And then after that, I would grab this, but I already did it, as I said, and you would make sure you pull it back, make sure you put it on top of it, make sure the placement is correct, and make sure it's not touching the stoma. That's very important. You don't want to irritate the area since it's such a sensitive, it's the inside of your organs, but it's just in the outside. So you have to make sure it's nice and neat, it's not underneath it. And then after that, you make sure you place it, and then make sure you peel off the tape, and then you put it around, make sure there's no bubbles, make sure everything is, make sure there's no hole, no area of, make sure it's not draining or anything. And then after that, you grab your bag, and then you press. Make sure you press hard enough and not be afraid of doing it, otherwise that could lead to leakage. And then after that, you end up with a lot of bowel movement all over, and that would not be fun. And then after that, you have the final product, and it's make sure it's sealed, and yeah, no leakage. And then if you change it, you have to make sure you change it after it's not fully full, so it's like after it's 3/4, you know, make sure we change it. And then we would just open this, push it down, grab our little basin or our little, each place has a different, what you would use. And so you could use a betapan some other times, or yeah, make sure we dispose that, we come back, we clean it off. Very important, we clean off everything, and yeah, that's how you would do that.
Can you cut?
Cut what? Yeah.
I would say 1/3. Because she. Mm-hmm.
Yeah, I didn't remember what it was. So yeah, you would have to make sure you empty it whenever it's 1/3 of the bag. Make sure it doesn't get past half or anything like that. And so yeah, you have your final product, and everything's sealed and secure. The next step is formulate a nursing diagnosis associated with altered bowel movement. So some of the diagnoses could be constipation, impaired skin integrity, and gastrointestinal mobility dysfunction. So those are some possible ones. For 14, explain how to teach a patient with a colostomy about safe self-care. So this is very important. It promotes independence with the patients, and it promotes them, you teach them how to do it. You have to make sure you teach them that they empty it regularly, to keep skin integrity, to contact the healthcare provider if there is any abnormalities around the stoma, any blood or anything like that, or infections. You have to make sure you teach them how to apply it, how to seal the bag, and how to be aware of leakage, and how to control the odor, because that could also prevent unpleasant smells. And then the last objective is demonstrate assessment of colostomy assessment. How to change any colostomy appliance. I already did that one. I left the one for it. And that will be everything.
Okay.
Bro, sorry.